everyone. My name is Zaid Al-Aly. I'm the Chief of Research and Development at the VA St. Louis Healthcare System, and I also direct the Clinical Epidemiology Center at the VA St. Louis Healthcare System. Welcome to Clot Chronicles. Today, I'm going to discuss with you our recent paper was published in Nature Medicine recently on the long-term cardiovascular outcomes of COVID-19. So what did we do in this paper? What we've done in this paper, we wanted to look at the long-term cardiovascular manifestations in people who got COVID-19. So we assembled a cohort, about 150,000 people with COVID-19, and compared them to two control groups. One control group of about 5.5 million people who did not have COVID-19, but lived during the same time period as those who got COVID-19. And another control group of also about 5.5 million people. And these people lived in an era that preceded the COVID-19 pandemic. These were not affected by anything related to the pandemic at all. And then we ran the analyses observing these patients for a period of 1 year. So what did we find? What we found is that in people with COVID-19, compared to the control groups, people with COVID-19 had increased risk of a variety of cardiovascular problems. Those included strokes, TIAs, atrial fibrillation, sinus tachycardia, sinus bradycardia, ventricular arrhythmias, and atrial flutter. We also observed increased risk of inflammatory heart disease, including pericarditis and myocarditis. There was quite a substantial increased risk of ischemic heart disease, including acute coronary disease, myocardial infarction, and ischemic cardiomyopathy. We also observed increased risk of heart failure. Most importantly for the group, there was actually substantially and significantly increased risk of thromboembolic disease, including pulmonary embolism and deep vein thrombosis. It is also very important to note that what we were able to find was that the risk was evident even in people whose disease was mild, in some cases was asymptomatic, meaning that had acute COVID-19 that was mild, in some cases asymptomatic. Even when we followed these people over time, over the span of a year, they still manifested with increased risk of a wide area of cardiovascular problem. And why this is really important? It's really important because this group represents the majority of people with COVID-19. Most people with COVID-19 in the US and in the world, they don't need to be hospitalized for it. They have mild disease, in some cases actually asymptomatic disease. So what we found was that the risk of cardiovascular problems was evident even in this low-risk group. And then we asked ourselves, well, gee, is the risk of cardiovascular problems really concentrated in people who had prior medical history of heart problems, or had previous risk factors, including hypertension, diabetes, chronic kidney disease, smoking, or other risk factors? So we did what we call subgroup analyses to analyze the risk in each of those risk factors. What we found it didn't really matter if you were young or old. It didn't matter if you were a female or male. It didn't matter if you were black or white. It didn't matter if you had obesity or did not have obesity, if you had smoking and did not have smoking, if you had high blood pressure or not, diabetes or not, chronic kidney disease or not, hyperlipidemia or not, or prior cardiovascular disease or not. It didn't matter if you were in any of these subgroups. COVID-19 was associated in all of these subgroups with increased risk of all these cardiovascular problems, again, including cerebrovascular disorders, dysrhythmias, inflammatory heart disease, ischemic heart disease, and thromboembolic disease. And why this is really important, because it really told us that, it didn't really spare nobody. It was an equal opportunity offender. It didn't matter if it didn't matter if you had high blood pressure or didn't, if you had diabetes or didn't. Even in people who had no cardiovascular risk factors whatsoever before they got COVID-19, after they got COVID-19, they were at elevated risk or increased risk of developing these cardiovascular problems. So in summary, what we really feel here is that COVID-19 should be interpreted as a risk factor for cardiovascular problems. And we feel that people who had COVID-19 should be attended to, should be treated with that lens, with that idea in mind, that COVID-19 puts them at a higher risk of cardiovascular disease, and they should be treated accordingly. Thank you again for hosting me, and delighted to have done this with you guys.